As we all know, every human body has two kidneys, which are primarily responsible for filtering the blood free of nitrogenous waste products like urea, creatinine, acids, etc., and produces urine. Millions of people are living with various types of kidney diseases, and most of them don't even have the slightest idea about it. This is why kidney disease is often known as a silent killer, as most people do not feel any difference until the disease is advanced. While people get their blood pressure, sugar, and cholesterol levels checked on a regular basis, they fail to get a simple creatinine test done in their blood to detect any unidentified kidney problems. There are a number of warning signs of a kidney disorder. However, most of the time these are ignored or confused with alternative pathologies because of their non-specific nature. Therefore, one has to be very watchful and should get the confirmatory tests, including blood, urine, and imaging, done at the earliest appearance of any sign of a kidney disorder. One should visit a nephrologist and clarify her doubts. But if you have hypertension, diabetes, obesity, metabolic syndrome as one calls it in today's age, coronary artery disease, and/or a family history of the same or a family history of kidney failure, or even if you're older than 60 years of age, it is advisable to get kidney tests done on a regular basis. While the only definitive way to diagnose a kidney disease is to get confirmatory tests done, here are some early warning signs of kidney disease. One of the early signs is the appearance of swelling over the ankles, feet or legs. One will start to notice edema at these sites, which pits on applying pressure and is termed as pitting edema. As the kidney function begins to fall, there is sodium retention which causes swelling in your shin and ankles. In short, any person noting new onset pedal edema should get an immediate evaluation of her renal function after visiting a nephrologist. Swelling or puffiness around the eyes. This is caused by the accumulation of fluid in the cells or tissues. It is one of the earliest signs of a kidney disorder. It is especially prominent in individuals where there is a leakage of a significant amount of protein via the kidney. Weakness. Early fatigability is almost always a universal symptom of kidney disease. One may feel more tired or exhausted than on normal days and will be unable to perform more strenuous activities, thus requiring rest more often. This is largely due to the accumulation of toxins and impurities in the blood, resulting from poor kidney function. Decreased appetite. Secondary to the accumulation of toxins like urea, creatinine, acids, the appetite of an individual is suppressed. Also, as kidney disease advances, there is a change of taste, often described as metallic by the patients. If one gets the feeling of early satiety in spite of barely having anything during the day, it should raise alarm bells in one's mind and one should get his or her renal function evaluated. Early morning nausea and vomiting. Another one of the earliest signs of worsening renal function in the presence of early morning nausea, which is often classically described as hitting the person when he or she goes to the bathroom in the morning for brushing his or her teeth. It also contributes to the poor appetite of the individual. Anemia. Hemoglobin level starts to fall. One might look pale, without any apparent sight of blood loss from the body. It is one of the common complications of kidney disease. This can also cause weakness and fatigue. The cause of anemia is multifactorial, which includes low erythropoietin levels, low iron levels, toxin accumulation causing bone marrow suppression to name a few. Changes in urine frequency and urgency. One has to keep a very careful watch on his or her urine output. For instance, the urinary output may decrease or you may feel the need to urinate more often, especially at night, termed as nocturia. It can be a warning sign and may indicate that the kidney filtering units are damaged or in the process of being damaged. Sometimes this can also be a sign of some urinary tract infection or enlarged prostate in men. Foamy urine or blood in urine. Excessive frothiness in the urine indicates the presence of protein in the urine, which under normal circumstances should be negligible. When the filtering mechanism of the kidney has been or is being damaged, protein, blood cells start to leak out into the urine. In addition to signaling kidney disease, blood in the urine can indicate tumors, kidney stones or any kind of infection. Also, pus associated with urine along with fever or chills can be serious and may again be a sign of a serious urinary tract infection. Thus, changes in color, consistency or nature of urine should be informed as early as possible to a kidney specialist. Dry and itchy skin. Dry and itchy skin can be a sign of advanced kidney disease. As the renal function falls, toxins tend to accumulate in the body, leading to itchy, dry, and foul-smelling skin. Backache or lower abdomen pain. Pain at the back, side, or below the ribs can be an early symptom of kidney disorder like renal calculus or pyelonephritis. Similarly, lower abdomen pain can be associated with a bladder infection or stone in the ureter. Such symptoms should not be ignored and investigated further by a routine imaging study like X-ray cub or ultrasound abdomen. High blood pressure. A presenting sign of kidney disease may be high blood pressure. Any person being diagnosed with hypertension must have a detailed workup of renal functions and kidney imaging to rule out renal etiology of hypertension. As kidney function deteriorates, there are sodium and water retention leading to high blood pressure. Symptoms of hypertension include headache, abdominal pain, visual blackouts, and may be the early presenting symptoms of kidney disease. Recognition and awareness of warning signs and timely intervention can mean the difference between early detection and treatment of kidney disorder or kidney failure, which could end up in dialysis, kidney transplant, or even death. This is Nurse Gracia's channel. Do not forget that we are here to bring you the best of the best. Kindly subscribe, like, and share the video. Thank you so much for watching, stay safe, and see you in our next video.